Okay, well, I want to welcome Jen to the show. And I'm really excited to have you here. And I was hoping, Jen, that you would be able to introduce yourself today.
Absolutely. I am so stoked to be here. So, for those of you who do not know me, my name is Jen Morgan. I am a doctor of physical therapy and I specialize in pelvic health conditions. So, that covers a wide variety of topics. We're talking bladder, we're talking bowel, we're talking sexual health, we're talking pelvic pain. I dabble in some low back and hips and some spine because that's all connected into that area, and then pregnancy and postpartum as well. Um, I am currently located in Connecticut, so I have my own clinic in the Connecticut area, but I do a lot of virtual and remote consult work. So the the span is super wide, which is exciting, and Instagram and podcasts like this make it even easier to stay connected, which is really exciting.
Yeah, and one thing I love about your Instagram is just that you kind of make this kind of maybe sometimes awkward topic to talk about. You make it really fun. You make it really approachable. Um, there's no kind of blushing or hiding when you say, pelvic floor or, vagina. It's all very like, this is what it is. This is what I do. Everyone has this. And I love that. It's takes away a lot of that shame.
Yeah, and I think the taboo, right? The tabooness around some of these things is just doing us a disservice. These are
Mhm.
topics that we should be talking about all the time, right? Especially with athletes and especially with individuals who are really pushing their body to do things that require coordination, pressure regulation, and stability, right? So there are a lot of things that go into, for example, handstand work, right?
Yes.
Hand balancing work. And so your pelvic floor and how your vagina and your bladder and your bowels are all functioning play a role in what it feels like to get upside down. So it's just something that really should be talked about way more frequently with every single person. There should be a class on this, I feel like, in high school, but it is what
Yeah.
it is.
Yeah, so I want to delve right in because this isn't talked about a lot in the handstand community, but it's actually really common, and that's queefing or vaginal flatulence when you go upside down, whether it's a handstand, a headstand, even just like a down dog in yoga. I've had people tell me that's their experience, and I've experienced it myself before, and yeah, I wanted to just start kind of like what's going on, why does this happen? um,
Yeah, let's jump right in. So this is one of those topics that is never discussed on day one of any of the sessions that I have. It kind of comes out as we are doing things that are more active, right? And we're talking more about this like inverted or inversion type of activity. And
yeah.
so, what is it, right? What's a queef, right? What is it? So, you've nailed it. It is vaginal flatulence or it is air that is coming out of the vagina. It can happen just doing any activity, sit to stand, laying in bed, rolling in bed, but most of the time it's happening when we are inverted or our hips are coming higher than like our head or our chest. And what causes it, right? What is the reasoning? So your vagina is a tube. It is literally a muscular canal, and we would like to think that it is very rigid, but it's not. And so sometimes we can have pocketing where air kind of gets trapped, for lack of a better word.
Mhm.
And then when we alter our position, that air now no longer is trapped. It's like, hey, I'm free. And the invertedness of that also helps to kind of pull it out of our body, for lack of a better word.
Right.
Now, what can be done about that? I talk a lot with my people who like to change their positioning, inverting my yogis, that the vagina itself is supported by the sling of muscles of your pelvic floor. And so, if there are muscles that are either too weak, and so they don't have enough tone to give your vaginal canal support, AKA creating some of those pockets, or muscles that are too tight that potentially are constricting that space and leaving a little bit of air or area for air to hang out. We
Mhm.
have to treat the muscles to give the vaginal canal enough support. That's step one. Step two is also managing our pressures. So, what does our breath look like when we are doing these activities? Because if our diaphragm and our pelvic floor are not regulating what's happening in our abdomen and our pelvis well, then we may potentially be having this like escapage of air or even of urine or other things from your pelvis that can be happening as well.
Right. Wow. Yeah. So if someone is experiencing this, like what's the, like, how do they know? Like it seems like it's these two opposite things. It could be either your pelvic floor is too weak or it's too much tone. Like, is there a way that you can kind of tell what that is? Or is it, go see a pelvic floor specialist and they'll help you figure it out? Like, what's the...
Well, I'm always going to say go see a pelvic floor physical therapist or therapist, right? Because there are some occupational therapists who also have pelvic floor training. And so anyone who is a pelvic therapist, we will say, has the training that you need to help evaluate what's going on. However, if you're kind of trying to figure out which bucket you fall into, so I really like the bucket analogy, right? We have bucket A, we have bucket B. We have weakness, we have tightness, right? So there is a really awesome screening tool that Nicole Cozine put together. She is also a doctor of physical therapy that specializes in pelvic health out of California. I will send that to you so you can link it for your peeps.
Yeah.
And it helps you to kind of screen with these questions. There's 10 questions that potentially would indicate that you got some pelvic floor stuff going on, right? So things like, right, so when we start talking about things potentially, taking a hard fall on your tailbone, right? That is something that potentially can disrupt your pelvic floor because your pelvic floor attaches into that tailbone or sacral space. Now, I'm sure people getting upside down, we've all had falls and we've all had things. Yeah. So potentially, if you were unable to stand up and you're like, oh, that was bad, you might benefit from seeing a pelvic PT. If there's pain with arousal, pain with penetration, if that's your thing, pain with any sort of intimacy, that could be secondary to a tighter pelvic floor, right? So something that doesn't feel as good because those muscles are a little bit tighter. If you're experiencing urinary or fecal or gas, even rectally, incontinence, most of the time that is more weakness based, but there are some times where it can be secondary to tightness, right? So incontinence isn't really the best indicator, right? Kind of like pelvic pain is definitely more tightness. Hip pain, low back pain, that is like, we're going to call it like quote unquote unresolved because someone's not checking out your pelvic floor. It's probably coming from your pelvic floor and potentially tightness, right? So you definitely want to get that potentially looked at as well. And then these other questions really just kind of go through other ways to tease out if pelvic floor PT is your thing.
Right.
Biggest take home that I tell most people is that, like, if it's been unresolved for a while and you've seen other providers, low back, hip, incontinence, even like queefing, definitely go see somebody. If people are kind of like shushing you off, like go do Kegels or go try this dead bug activity that's not functional, right? For you guys, right? Because you're on your hands, you need to be getting on your hands. Go see someone who's going to actually like put you upside down. And pelvic floor therapists are really good about getting you back to function. I feel like, I'm very biased, but I feel like for me, I mean, yesterday I had someone who has like a history of like working in circus and doing those types of things. And she was upside down the whole session with me yesterday. So it's super cool to like see those mechanics and those things happen. Find someone who can do that for you is like probably my biggest take home.
Yeah. Yeah. That's a really, really great advice. So how would someone, how would they find a good pelvic PT?
Awesome. So there are pelvic therapists across the globe, right? In the United States and in Canada, it is very easy to find somebody. There are 3 search engines in America and like the United States. And then there's like one really good one in Canada. I'll send you those links so you can link it for your people.
Yeah.
If you're on your phone ready to hear the link right now, the one that I recommend most for the United States is pelvicrehab.com. You can search by your zip code. What I will say though is that when you look at that website, it will pull up everyone in your area. Read people's bios. If you really want to find someone, in my opinion, that has a bio on there that took the time to curate this, like, here's what I treat, here's who I am, let's rock and roll and do the thing, right? If they don't have a bio there, fine. Maybe they just didn't have time to do it. You can call the office. I recommend always never go in blind. You want to know who you're seeing, even if you have to call the office and be like, hi, this is what I have going on, or this is who I want to see. Is there any way that I can like reach out to them? That will help to like take the taboo away, if you could like physically hear their voice on the other end, or see if they have an Instagram, right? So you can physically see their face. COVID and masks have totally, they're safe, and I understand why we need them. I wear masks all the day, but my patients only know me from Instagram. They don't see my nose down, basically. So I'll give you the 3 search engines. I'll give you the international search engines. Pelvicrehab.com is the one that I typically recommend in the United States. But I would say reach out to your people before you go see them. You want to make sure you vibe with them. That is key.
Yeah. Awesome. Yeah, that's going to be super useful. What about someone who maybe they have this, queefing when they do handstands, but they don't have any other symptoms. So there's no like pelvic pain, otherwise, no lower back or hip pain. And it's just something that's like maybe a little bit embarrassing. They may be like, yeah, I don't really think I need to go to a PT, but is there some things that I can do, or is this normal? Like, what would you recommend in that situation?
So I think the first thing that I would want to start looking at with that person is I would want them to explore their breathing patterns, and then what's happening with their core canister function. So if you have a mirror at home, right, like a full length mirror, you can do this at home. Take a couple breaths and figure out where your breathing pattern is. Are you breathing from chest? Are you breathing from belly? Are you doing like a combo? Like what feels good for you? Are you expanding at your rib cage laterally, so to the sides, and then also front back? So you want to start mapping out where are you breathing into. Then I'd want to also figure out when you are quote unquote engaging your core. Right now, mind you, engaging your core is such a hot topic, and it's like, you want your core engagement to match your exercise. You do not want to be like super hard flexing your core for every activity. That's like such a pet peeve of mine. It's like a soapbox by itself. But if you are engaging your core and your core looks like it's kind of bearing out to get tight, quote unquote, to give you that stability, you're actually pushing your pelvic floor down. And so that can be contributing to some of that like vaginal queefing or that flatulence. So if you think of a balloon, if I were to press the front part of that balloon backwards or inwards, the bottom part of the balloon is going to almost quote unquote bottom out. And so that type of pressure regulation issue is actually something to work with a pelvic PT on, because we want to coordinate what's happening in the pressure, like with your core, with your pelvic floor, and then also with your respiratory diaphragm, to make sure that everything is actually, for lack of a better term, like properly engaged without creating more tension in a different area of that core canister.
Right.
So if you stand up in the mirror and you're seeing yourself like bear out, or you're like really trying to like bear down to give yourself that stability, that's like a dysfunctional coordination. So you actually would benefit from some time with somebody one-on-one, maybe just a couple of sessions to work on finding that. I will say there is someone on Instagram who I freaking love, and I know her from Phoenix. Her name is Ashley No, and she does a lot of like core work. Her demographic is for more of like postpartum individuals who are having diastasis, but her foundational core work stuff goes for everybody. And I have learned so much from her. So if you're looking for someone to like scroll on Instagram and go into the vortex, Get Mom Strong is actually her Instagram handle. And she's pretty rad in terms of foundational core work. And every single person should be doing that, in my opinion. Foundational breathing, engagement, activation. Are you finding your obliques? All the things. So things that you can start checking at home, but also start doing at home.
Yeah. Yeah. And that's awesome. I mean, that's stuff you can do as like prep for your handstand practice. Like get things firing before you get upside down. Yeah, so I think that's really great. Just being able to look in a mirror, see if you can see like where your breathing is happening. I think a lot of people though, when they do go upside down, it's like all of that goes out the window. Like all the stuff that they can do fine standing on their feet, but they go upside down and it's all of a sudden it's just like, I'm just gonna hold my breath. And so is there some specific things you would have for someone who's like, okay, my breathing is, I feel like it's pretty good standing on my feet, but when I go upside down, how can I implement the same breathing patterns? Because even for me, who've been doing handstands, I don't even want to know, 35 years, more than that, actually. when I go upside down, my breathing is definitely harder. It's shallower than it is when I'm on my feet. And part of that is having my arms overhead, being in like pulling my ribs down, like all these things. So do you have any kind of recommendations there for someone?
That's tricky, right? Because you're right. You need to be able to, I think I'm visual. I need to be able to like see myself what I'm doing in that moment. And even thinking back to yesterday with this client that I had, the minute that this individual got upside down, we had rib flare, we had this, we had, like some like curvatures in our back that I was like, whoa, we're like all over the place. And that's going to change what's happening in like our core canister and our pressure regulation. It's going to put more pressure on your pelvic floor. And so then we're going to lead to more queefing, right? So it's really all about managing that. So gosh, what did we do yesterday? So yesterday, what I did, which this doesn't really do much for her, but I put her against a wall, right? So literally she was up against a wall and I put a mirror on the other side of her. So she could kind of do a visual. And then I just was doing more activation of like, okay, can you send your breath here, this like lower part of your ribs? Can you not flare out? It is really hard when you get upside down. So we try to do as much training on our backs to start and then potentially baby inversions. I use a lot of yoga postures as well to like start implementing inversion. So like down dog, like you mentioned before.
Right.
Yeah, I totally have like, I've gone off on a tangent. My brain is like so like clinical right now. I'm like, oh my gosh, like what are all the things that I did yesterday? But it is difficult when you get upside down. I don't think I answered your question. I think my brain went on a tangent.
No, I think that's perfect. I think, like starting on your back, like that's already a progression to upside down. Down dog, we're getting more inverted. Other yoga poses, I mean, perhaps like a shoulder stand or a headstand.
Ooh, yeah. So I really like a headstand. I think headstand is great. More so, depending on what your center of gravity is, right? So if you have more of the tripod headstand, your center of base is much bigger than if you're doing more of like a true, like elbows in type of headstand. Then what actually I did yesterday, which was really beneficial, I think, was more of like, I call it like an L stand, if you will. So hands on the ground, feet on the wall type of scenario. And then even just starting to rock your base of support from the L stand, we progressed into like a hands on the floor, feet on like a 72 centimeter like ball. And then she was like piking up to get hips over shoulders. That was great. And I actually had her hang out in that position to make sure ribs were not flared. What are you doing? What is the proper engagement? And for me, I actually have the training that at the top, when she had her hips, quote unquote, stacked, right, as much as she possibly could, what was happening in her pelvic floor? Could she find her pelvic floor? So that was actually pretty tricky to manage those pressures for her. But most of the time, for most people, transverse and pelvic floor, they're besties. So we want our transverse core to be working, and hopefully our pelvic floor is just like, I'm coming along for the ride, which is great because it means we're not going to over contract. That's what we're looking for. Where do we go after that? I think that those are like the ones that we spent the most time in yesterday, the L stand, the piking up on the ball, and then eventually we got her against the wall upside down. But you want to take it as easy as possible, right? You want to start relatively passive, progressing to something that doesn't feel too hard, and then eventually you're working your way up to more difficult things.
Yeah. No, I think that's great. My guys will all know those exercises. So that was perfect. I have a question though, a follow-up question from that is, how does someone know if they're feeling their pelvic floor or if their pelvic floor is doing what it's supposed to be doing? And I think that's a big challenge for a lot of people, maybe myself included.
Yeah. I would ask a follow-up question to someone in my session would be, have you taken a mirror to your pelvic floor? When's the last time you actually looked at your vulva? Right? When? Most of the time people are like, hell no. Like, hell no, I've never taken a mirror to my pelvic floor. And then, we start going down the whole like exposure, vulva, or like, are you looking? What does it feel like? Now, best thing to do, self-exploration. I'm a huge fan of like, okay, so if you are laying on your back, mirror at that, vaginal opening, vulvar exposure, can you lift? Think about picking a blueberry up with your vagina. So we're thinking both sides and front back kind of contracting around and then lifting. You don't want to crush the blueberry. Don't do that. But like, we want to like think about just gently lifting and holding. If that feels really difficult, like if you don't see anything moving externally on the outside, if you're feeling fancy and courageous, I would strongly recommend washing your hands, putting a finger inside that vaginal canal. What do you feel happening? If you do not feel the contract and the lift, you feel more pushing and bearing down, you're actually doing truly more of you're pushing your pelvic floor open and you're not giving your vaginal canal the support to not have air flatulence, right? So
Right.
that would give you a lot of information if you were feeling so inclined to insert your finger into your vagina and give yourself that coordination and that feedback. If you do that in that supine position on your back and you're still like, it's not happening, you probably would want to get into an inverted position. So either legs up on a chair or a couch, put some pillows underneath your hips so hips are slightly a little bit higher, to see if we can pull the organs and the contents away from the pelvic floor. Does it make it easier for you, right? So that's something to think about. If not, find a pelvic therapist, 100%. Like if you're like, I'm bearing down, I can't find it, it's probably because you are a visual and tactile learner and you can't see or feel these muscles without some kind of extra-ness, right? So that would be an indication to find somebody.
Right. That's perfect. That's great. And I think one of the questions that my community asked about this is, should they be feeling this like, maybe they can feel it standing, but what about like when they're squatting? Should they be feeling it during those type of exercises? And what about, lifting weights, doing these kind of things?
Yeah. So I'm a full fan that like your body is crazy smart and is naturally going to do the things it needs to do once we get it trained to do so. So should you be constantly Kegling when you're squatting, when you are walking up the stairs, when you're doing things that are like quote unquote daily activities, like walking or running the whole time? No. Do you want to use your pelvic floor like you use your quads and think more exhale on exertion? Yes, right? So like when you're low in a squat, your pelvic floor, depending on your foot position, is lengthened and still holding things up, right? So we don't want to be trying to Kegel in that position because it's harder, right? Why would we need to do that unless you feel like your pelvic floor is bottoming out, which you should see somebody for that.
Right.
But when you stand and maybe you're lifting a heavy load or you're doing a deadlift or you're doing something like that, and you're thinking about glute engagement, hamstring engagement, your pelvic floor naturally probably is actually doing the work and engaging with it. But you should be able to clue in and feel like, okay, do I feel that happening? Because that's when you would want that to happen. You want to pair all of your work. In terms of, being in like a low, deep squat, like a malasana, no way. You don't need to be Kegling in that position, and that would be crazy hard. But with your heavier lifts, managing your pressure, we're going back to managing pressure, with your breath out, engaging your core, engaging the other muscles that are working and your pelvic floor, that would be the right time to do it.
Okay. Awesome. And so by this concept of managing your pressure, how does someone someone who's never really thought about this before, like what would that look like to them?
Right. So biggest take home for managing your pressure, are you holding your breath, clenching and turning purple in your face, right? If you are doing those things, you're not managing your pressure. You're pressurizing your canister, right? So you're increasing the pressure of what's happening in your abdomen, your pelvis, and in your chest. And in turn, you're having some like crazy tension up through your head, chin, jaw area. What I mean by managing your pressure is you want to regulate your breathing to work with your musculoskeletal system. So when you are breathing out, you are engaging the proper muscles for whatever it is that you were doing in that moment. So if it's a deadlift, if it's a squat, if it's a handstand, right? Whatever it may be, continuing to breathe and finding your muscular activation is going to be crucial in managing your pressures. So if you're holding your breath, you're not doing it. If you're focusing on breathing, you're doing the right things. You just want to make sure that you are finding the muscles that you need to find, depending on what their needs are in that moment, to be more of like managed, quote unquote.
That's perfect. And that kind of reminds me of something Shante, the movement maestro,
Love her. I
yes.
love movement maestro.
Yeah, that's how we got connected through movement maestro. So like one thing she said at a workshop was like your breathing is like your internal Fitbit. So it lets you know if if you're able to breathe, if you're relaxed, doing that nice pressure management, as you kind of said, you're doing the right thing. Whereas if you're like holding your breath, your face is going red, again, that's your body telling you that maybe you need to kind of maybe step back a little bit, do some regressions, or focus a little more on the breath as you're doing it. So I always love that analogy that she used.
That's great. No, that's so true. It's so true. And I might snag that from her when
Yeah.
I'm teaching clients. That's great.
Yeah. And I think that breath holding in a handstand is so common. And I remember when I first started teaching adults, this was like way back. My wife was the first adult that I taught the handstand, and she said, "I can't breathe." And I was like, no, don't. Breathing's advanced. Breathing upside down is too advanced for you right now. And then I was like, as I kind of learned, I was like, oh yeah, no, that's a really stupid thing to say. And so obviously now, like, I teach a lot more about learning how to breathe upside down. And it's the same idea as you were talking about, is just like making sure you can do any of these progressions. Can you do it lying down on the floor? Can you do it at like, in that pike handstand? Can you do it in a incline handstand? Can you do it at the wall in a handstand? Do you have any other thoughts on how to progress it to a particular movement?
I think a lot of individuals, we've never been taught how to breathe, ever. We're just assuming we know how to do it because we're alive. And so truthfully, starting to take note of your breathing and just sitting, what does it look like in your workday? Because everything that you do in like your workday and your home life, if you can't breathe well there, you're not gonna be able to breathe well when you're trying to do an advanced motion like a handstand. So take it back, and see what is like the foundational aspects of your life look like when you're trying to breathe, and go from there before you put yourself into an inverted position.
Right. And so would you just kind of check in every now and then during your day and be like, well, how am I breathing? Or do you have a...
Yeah, I call it, I have someone check in if we're focusing on breathing. It's like a 3x10. So I have them do 3 breaths 10 times a day.
Right. Nice.
And part of that 3x10 is also, am I clenching my glutes? Am I clenching my pelvic floor? Am I clenching my jaw? Because those 3 areas are a big indicator that if we're clenching during the day, we're definitely going to be clenching and holding our breath when we're trying to get upside down. So 3x10, 3 times a day, take a moment in any position, laying on your back, maybe legs up on the wall. Maybe you are sitting in a chair at work. Ground yourself, right? Both feet on the ground, or if you have both feet like crisscross applesauce, external rotation, take a couple breaths and see what happens. When you breathe in, what I like most people to see is, can you sense that your pelvic floor is doing a slight, very tiny descent, right? So it's expanding. If you're not sensing that, take a rolled up towel and sit on it like a saddle and see if that extra feedback against the pressure of your pelvic floor helps you to feel that descent. Some people have used a foam roller. That's crazy, like dense sometimes. I don't love that personally. Could do that too. I prefer like a rolled up beach towel, for lack of a better term. It gives you like nice like diameter and it's still soft. That is kind of another position for most people in a seated position, that a 3x10 feels good.
Right.
10 times a day, checking in and kind of seeing what does your breath look like and making sure you're not clenching those areas of tightness.
Yeah. And so with the rolled up towel, you're just sitting on it, like you put that on a chair and then just sit on it?
You got it.
Yeah. All right. Perfect. Yeah. I find the jaw clenching is the thing that I notice a lot. Like that's what when I notice that I am not breathing properly, I'm like, oh, relax my jaw, relax my face. So for me, that's the big indicator. So yeah.
I just read a really interesting article. God, it had to be like 2 months ago, that we think about this quote unquote core canister, and we think about like your transverse, we think about your multifidus of your back muscles, we think of your pelvic floor and your respiratory diaphragm. So 4 parts. There's actually a 5th, and that's glottis, right? So how are we breathing in terms of managing these things? And I was like, yeah, this is something I've been saying for forever, but I just didn't have like the terminology. And I'm like, yeah, your core canister is actually 5 parts. So when you're talking about jaw, I'm sitting here being like, oh yeah,
Yeah.
that's it. Like thinking about how are we clenching, how are we like managing up here in your face, huge. It's crucial.
Yeah. And that's like when I'm doing like mobility work and I realize that I'm clenching here and I relax, it's like everything, like my breathing starts to go better and then I can just get deeper into positions. It's like huge. It's huge. Awesome. I have a few more questions from the members of my community. So one of my students is worried, as well, interested in how do we strike a balance between like engagement and release. And I think one thing she notices a lot is she's kind of sucking her tummy in, right? And, I think that's something, through like society, just, you don't let your belly hanging out. You want to, have that, tight abs. And so we can kind of get into that habit of like, okay, suck my belly in. And what's your thoughts on that?
Oh my God. The first thing that comes into my mind is like Frozen Let It Go song. Like that's like literally what comes into my head. Listen, this is something that society has trained us that we need those like flat. Don't let your belly hang out, right? But when we suck in, a couple of things happen. You put more pressure on your pelvic floor, and sustained pressure on your pelvic floor with suck-inage is going to make us feel less connected and potentially weaker, or we're going to compensate in other areas of our body, like our glutes or our rotators of our hips. But it also potentially can increase a rib flare. So that is where things get tricky. And the best thing that I tell most people is we need full range of motion everywhere in our body, right? So biceps, quads, we should be able to fully extend our arm and fully bend it. In your core, we should be able to take a nice deep breath and not feel like we're super restricted and find that engagement. So I would put a little test out there, or recommend a little test of, if you were to not hold your core in all day, every day for like 3 days in a row. So focus on just like letting your core do its thing 3 days in a row. What do your handstands feel like? And what does your mechanics feel like on day 4? Right. And just see kind of how it goes, right? Because you may notice that you are feeling stronger and more coordinated on day 4 after not holding your core in all day long for the first 3 days. So I would just be curious to see. It's kind of like, why would you hold your arms at 90 degrees for 3 days in a row? It's what you're doing. So I would say try that. And I would love to see that individual report back to you, and then you let me know. I'd just be curious.
Yeah, no, I think that's really cool. And because I think that's something that happens a lot with people in their handstands is they kick up and they know they're supposed to have tension in that hollow body. So they're so tight that they don't have that ability when they lose balance to be like reflexive, kind of kick in and make that correction. And so you can't have that super tense because then there's nowhere to go.
Yeah.
So yeah, that makes a lot of sense. I'm curious as well. So I'll challenge that person.
I love that. I'm excited.
Awesome. Okay, so I think most of these questions have been answered, but just this last one, I think you kind of covered this at the beginning, but the question was diastasis recti is something that people think, oh, I have this, I should go see a pelvic floor specialist. Like, I guess what other things should people consider coming to see a pelvic floor specialist for?
Totally. So diastasis recti, totally 100%. Any sort of leakage of any kind, right? So incontinence of urine, fecal matter, gas, whatever. Constipation or diarrhea, right? So if you're having any sort of like stool consistency issue, like that would be something to do. Urgency, frequency of urination or of having bowel movements. Any sort of pain in your pelvis. So pain with intimacy, arousal, inability to achieve orgasm, difficulty with penetration, if that's your thing. Chronic hip, low back, like sacral tailbone pain that maybe you've seen other people for and they're like, injections or I don't know, because that happens a lot. because no one's looking at your pelvic floor, but it could be coming from that sling of muscles potentially. Potentially even some sciatica that's a little bit unresolved. I see that a bunch where it's like, I've always had sciatica, or I've always had this. And I'm like, that's not cool, right? So those are
Right.
probably some of the big things. And then in terms of like just movement in general, if you're finding that managing pressures is hard, so if you feel like you can't find your pelvic floor, that would also be an indication to see someone too.
Yeah. Yeah. That's really great. Just because I think, we think it's got to be that, like, either the diastasis recti, which is something people know a little more about, but also like, or, leaking, or, something, but like the hip, lower back, even the sciatica, like those things are, things I see a lot. And I don't think many people have considered that that's a pelvic floor, something that could be a pelvic floor issue.
And you don't have to have quote unquote something wrong, right? I think that
Right.
like my biggest shift in my practice in the last, like, I don't know, year or so is that you can come see me or any other pelvic therapist just because you want a once over, just because you have been working on inverting and you're like, it just doesn't feel quite right, but I feel fine, right?
Yeah.
Quote unquote fine. And you may find that you are functioning in a space that you've always kind of functioned in, of like you're just living and you keep on keeping on. But there are things that can be refined to optimize your life.
Yeah.
And cool, you're not leaking, you're not having pain, everything feels kosher and great, but you definitely may see some benefit to just having a little bit of like zhuzh, right? Of having somebody just like help you out a little bit in areas that you didn't even realize needed attention.
Yeah.
So never hurts to go have a once over.
Yeah. Yeah. And I think it's something that, people like, oh, I don't want to do that. So if someone is kind of feeling, and I like from your Instagram, I'm definitely, I get that feeling that you're very much about like, it's not something to be embarrassed about. It's not something to, feel shame around. And so what would you say to someone who's a little nervous perhaps about going to see a pelvic floor specialist?
Yeah. Everything is a maybe, nothing is a must. I tell everyone that. And what I mean by that is I do not quote unquote have to, or it's not a must that I actually get my hands on your pelvic floor day one. I do not need to do any sort of internal assessment to actually get useful information. So if you're coming in and you're like, man, I like don't really want someone touching my pelvic floor, your space is yours, right? I don't even need to come near you to still give you any sort of useful tidbit or nuggets of info. There is also a lot of objective measurements we can take where maybe we just palpate externally and all clothes stay on, right? Maybe we just look at your like low back mechanics and how you're breathing and what your core looks like. Truthfully, there are so many things that a pelvic specialist can look at and still give you useful info with actually never touching your pelvic floor, but I just have my pelvic floor hat on. So if that is the biggest hangup for an individual to go see a pelvic specialist, the minute you walk in the room and you start telling your story and we start talking, I always ask, here's what my objective measurements are going to look like today. None of these things have to happen. A lot of these things are very helpful. What are your thoughts? How do you feel about it? And
Right.
I find that that's really how most therapists approach it. So you have the ability, and I also always say, I'm like, we don't have to do any of this. And I think that puts a lot of people at ease. We don't have to do any of these things today. They would just be a bonus. And that's a big thing. So you have the power to say, listen, I want the info. I'm totally cool with external work. Internal work, I don't know yet. And that's okay.
Yeah. Yeah. I think that's very reassuring for a lot of people. And it's the same, like I say the same with handstands. It's like, you don't have to, anything that feels like, you don't have to do it. It's all optional. So yeah, that's fantastic. Is there anything else that you want to share that you think would be helpful? I'm sure there's a lot, but anything that's kind of burning that you want to share?
Oh man. Anything burning that I want to share? I feel like truthfully, every single person that is going down the path of like wanting to, you know, do handstands and invert, you're doing something crazy cool with your body, right? You're doing something that is challenging in a good way, physically, mentally, all the things. And so to get to that goal, do not be afraid to onboard somebody else onto your team, right?
Mhm.
So if you're wondering like, oh man, I'm almost there, I can't get it, just don't be afraid to consider having a conversation with somebody like me, like a pelvic
Yeah.
therapist. I think that hopefully this just takes away the taboo of like, I don't want someone touching my pelvic floor.
Yeah.
Totally get
Yeah.
it. But I think that would be the only thing I would want to say, like go out and get the care that, or like the additional support that you deserve, right? That's, I
Yeah.
think, the biggest thing.
Perfect. I actually thought of one other question while you were saying that. So I know a lot of people who maybe, you know, they've, you know, had children, or maybe they haven't, but this has been a problem for a while, that they have this when they go upside down, and maybe they've avoided things because of it. Like, is this something that like can always be fixed or can always be improved? Or is there just like, sometimes it's like, you'll probably have this when you do inversions. It's just, you know, things have changed after giving birth, and now you'll probably have this, you know, going forward.
Ooh, that's a big question. So what I will say is I truly feel that every person can find some success. We just have to make sure that we are setting our goals with that mindset, right? So when I write goals for somebody, if they're having, you know, queefing, and say they may more fall into the pelvic floor weakness bucket, and maybe they're holding their breath and bearing down in their pelvic floor. When I write a goal for that, if we can start talking about, you know, this individual will be able to find the proper coordination and breath work within a certain period of time. And then we start tracking, maybe they notice that they no longer have queefing in down dog, but handstands, right?
Mhm.
Then we would start teetering our goals towards, okay, now we've noticed that the queefing is diminished by 25 to 50%. So we want to start thinking about it in terms of what can we quantify. Nothing ever is hopeless. We're always going to learn something, and we're always going to see some kind of improvement or progress. We just have to frame it in a way that we deem to be successful. And so I fall into the category that nothing is hopeless ever.
Right.
There's always something to be learned and to be gained. And especially if you are someone who is postpartum, it could be 6 months, it could be 16 years. There's always improvement to be had. It's never quote unquote too late. I know a lot of times people are like, oh, you've had a child, you've given birth, you're going to leak forever. Like, no, absolutely not. So do not let that deter you. Even if your kid is in college, all
Right.
is good. Still seek out the care, because you can still see improvement.
Yeah. Awesome. Well, I think that's a great place to finish. So thank you so much, Jen. I think this is going to be so helpful. There's really not a lot of information out there in the handstand community on this topic. So I'm really excited to share this.
Thanks for
Thank you
having me.
so much.
This has been great.
Awesome.